By now, this woman was supposed to be dead. Her name is Cheryl Boyce. Statistically, she should have died 16 years ago, which, by the way, is also what Prince Charles mutters to himself when he practices sitting on the throne. Cheryl's lived 20 years with multiple myeloma, a fatal blood cancer, and her story is more important to your life than you think. Because when we ask, why is Cheryl still alive, it actually helps us answer a much bigger question. Why haven't we cured cancer? I'm David Vance, and you're watching SpellChek. I'm so passionate about healthcare, I was literally born in a hospital and conceived in one. By the way, if you have multiple myeloma, trust me that you'll want to watch this one to the end. Now let's talk cancer. There's a problem in healthcare that's killing people. It could have killed Cheryl. It may have hurt someone you love. And it's a problem that's extremely solvable. Here it is. In many ways, healthcare acts like the internet doesn't exist. And yet doctors have no problem believing there's something called germs. Here's what I mean. If you really wanted the internet to make healthcare better, you'd build something I'll call a twin machine. Here's how. First, you would tell our millions of patients that they can do one thing right now to save lives, maybe even their own: anonymously share their medical records. Now, some will say no, but millions will probably say yes, which is also the description in my Tinder bio. So you take all the yes patients, remove their names, encrypt their data to keep it safe from hackers, and then make a database of their millions of records. And here's where it gets cool. And bear in mind, I'm from Idaho, so I know cool. Now you use that data to build a twin machine. A twin machine is a program that basically finds all your twins, the patients most like you, and sees what worked for them. So when a patient like Cheryl first gets sick, she can enter her condition, age, ethnicity, even parts of her DNA. Then she and her doctor can look at all the patients in the country like her. If drug 1 gave Cheryl's twins a 50% chance of remission, and drug 2 gave them a 70% chance, the doctor would probably prescribe drug 2, unless number 1 has a hot drug rep. Now, that may sound simple, but it's a game changer. The internet is perfect for making twin machines. Do you know how Amazon knows what you want to buy, or Netflix knows what you want to watch? They have twin machines for shopping and watching. They just look at thousands of people like you and see what worked for them. If we can use big data to keep you shopping or keep you watching, why can't we use it to keep you living? So that you can keep shopping and watching. Now, someone is building a twin machine for healthcare. If you have multiple myeloma, they can help you right now at this link. But first, here's what Cheryl went through without one. She ran into 2 huge problems that affect most of us, and that a twin machine could help solve. Cheryl spent over 20 years leading the Ohio Commission on Minority Health, an agency she helped create to fight health inequalities. I thought about doing that, but instead I watched the A&E 6-hour Pride and Prejudice miniseries. So I guess you could say we're both heroes. In 1998, after years of worrying about other sick people, Cheryl got sick herself.
The doctor sounded like he was crying. And he said, I don't know how to tell you this. I think you have multiple myeloma. And I was like, oh God, not me.
Cheryl immediately went to a general oncologist or a cancer doctor. And when he saw Cheryl had an aggressive, fatal cancer, he recommended waiting. He said if the cancer damaged her bones, they could do chemo to take the edge off.
I have cancer, and the doctor said we're gonna watch it. And my question is, watch it do what, grow?
Turns out that's terrible advice, and it may be part of a bigger problem, which is doctors who haven't seen many myeloma patients struggle to stay up to date. In fact, one study found that if you get treated at a less experienced myeloma clinic rather than a more experienced one, you'll typically die almost 2 years sooner. That's losing 2 Christmases, 2 birthdays, or if you're my parents, 2 years of being disappointed in me. Comedy's a real career, Mom. Please don't cut off my allowance. Or tell Dad I have one. Now, it's not that we have bad doctors, it's that we have a bad system. It's problem 1. Doctors need better information. Like the information of how to stay married or make a hospital gown that covers the human butt. If tomorrow a researcher found a treatment that could help Cheryl's doctor may not start using it for 17 years. That's how long it takes new innovations to become widely used, according to some studies. Part of the problem is that we don't have a twin machine to spread innovation quickly. Here's what we have instead. A researcher tries a study on a few dozen patients, and maybe it succeeds. If so, maybe it gets published in a journal. If it does, maybe the journal doesn't cost too much, in which case maybe Cheryl's doctor reads the article, and then maybe he or she recommends the treatment for Cheryl. Or maybe they wait a few years till everyone's doing it. I haven't heard that many maybes since I asked my parents if they were proud of me. And they said maybe we shouldn't talk about it. And the worst thing is, in the meantime, Cheryl may die because her doctor doesn't have enough information. Now, luckily, Cheryl survived. She read the research, referred herself to a new doctor, and went into remission for 6 years. But when she relapsed, she ran into problem 2. This time, Cheryl decided to move to Arkansas, which was a great decision, even though it's usually a terrible one. Specifically, she went to a specialist at a top multiple myeloma center. By then, she'd been treated at 3 major hospitals. and she noticed something.
Out of all of the places I had been for treatment, I had never seen another African-American person, yet multiple myeloma is a disproportionately African-American cancer.
Bear in mind, Black Americans are twice as likely to get multiple myeloma as white Americans, yet Cheryl didn't see any in all 3 myeloma wards. And that's the second problem. Patients with unequal care need better information. Right now, there are lots of predictors of unequal care, like ethnicity, poverty, gender, and living in rural areas. And often these patients don't know what treatment they need or can't afford it when they do. Now, Cheryl got the right information at the right time. Her next round of treatment sent her into remission for 10 years. Most patients aren't so lucky. But we think a twin machine could help get them the information they need so they can better consult with their doctor. In fact, as you'll see in a second, it may even help us cure cancer. So now someone's building one. It's called HealthTree, a twin machine for healthcare. HealthTree's starting with multiple myeloma, but once they get enough patients to prove it can work, they want to go after leukemia, ALS, and other deadly diseases. Today, if you have multiple myeloma, you can go to healthtree.org and anonymously enter your medical data. As soon as you do, you'll get a one-page printout telling you the treatments preferred by the best multiple myeloma doctors for patients like you. Then just take that printout and show it to your doctor as you're deciding treatment together. My doctor says she'd much prefer that to the WebMD articles I usually bring. Apparently, I'm not pregnant. And HealthTree.org is totally free. It's run by a nonprofit, so it won't sell your data to corporations like Facebook or use it against your will like Facebook. It's anonymous and encrypted to protect you from hackers. And if you ever want your data deleted, they'll do it because it's yours. In other words, you're not giving your data up. You're just anonymously sharing it with other patients like they're sharing theirs with you.
I think what's unique about HealthTree is that the target for the information we're providing is the patient. So it's about patient empowerment.
That's Dr. Rafael Fonseca, chair of medicine at the Mayo Clinic in Arizona. In other words, one of the best doctors at one of the best hospitals in the world. HealthTree was his idea. And his other idea was to become a rich doctor, so he has a good track record. And here's the cool part. Once enough people sign up, it becomes a twin machine, meaning it starts finding your twins and suggesting treatments based on what worked for them. The more people join, the better it gets. And the better it gets, the more people will want to join. Kind of like how being hot can make you richer, and then being richer can make you hotter. So if you have multiple myeloma, click the link or go to healthtree.org to sign up and fill out the survey. Then you'll immediately get your one-page printout to discuss with your doctor, plus an education on how to live with your disease. If you don't have myeloma, help us reach the people who do. It usually afflicts older patients, so this could be your parent, grandparent, or a billionaire lover whose fortune you want to inherit. So maybe don't sign him up. If those loved ones struggle with online tech, go through each step with them. If they don't have internet, call this number with them. Because being less tech savvy shouldn't doom someone to worse healthcare. Do you want your dweeby 13-year-old cousin to be healthier than you just because he makes video games? No. You want him to get bullied. What? Oh, I can't say that. Finally, if you struggle with medical bills, HealthTree will soon have a feature to connect you with financial aid you qualify for. So you may be able to afford treatment you thought was too expensive. So click the link or go to healthtree.org to try it today. If you don't know anyone with myeloma, you can also make a tax-deductible donation. Now, we've talked about making healthcare more equal, but that's just half the story. Let's talk about how a twin machine may help find a cure.
I personally believe that we're very close to achieving a cure for a significant fraction of myeloma patients.
These are the founders of HealthTree, Jenny and Paul Ahlstrom, who created it soon after Jenny was diagnosed with multiple myeloma. Jenny's a mom of 6 kids, a cancer survivor, the founder of Myeloma Crowd, and the president of HealthTree. I almost did that, but I found out you can watch Pride and Prejudice twice. She's lived 8 years with myeloma, and like Cheryl, she also got a first treatment recommendation that was years behind.
He's treating breast cancer, lung cancer, prostate cancer, kidney cancer, and there's no possible way that he could possibly know how to stay up to date on myeloma. There's no way.
So Jenny switched to a specialist who helped put her in remission for 7 years. And when Dr. Fonseca had the idea for HealthTree, the Ahlstroms used their tech experience to create it. Jenny was a systems engineer at IBM, and Paul's a venture capitalist behind companies like Ancestry.com and Space Monkey. I don't know what a Space Monkey is, but it sounds wonderful. I would vote for it as president. But soon they noticed a third big problem. Researchers need better information. Right now, most medical studies require lots of funding, time, and lengthy approval. And at the end of all that, most researchers usually have fairly limited data. Now, we'll always need these clinical trials, but what if we also had a twin machine? Imagine what research would be like if doctors had data not from a limited number of patients, but from thousands or millions. Still boring, but with a better chance of finding a cure. We're closer to a cure than you think. Multiple studies find a small percentage of myeloma patients have already been cured, even though we once thought this was an incurable disease like lupus or belief in human kindness.
One of the doctors that we talked to said, we think there might be 10% of patients that are cured, but we don't know who, why, or how.
Who are those patients? Maybe those patients are the ones that stay on treatment. Maybe there's certain features that make a person be part of that group. And HealthTree will capture this information.
If HealthTree can build a giant twin machine and figure out what cured some patients, maybe we can find a cure for most patients. That's why HealthTree will be open for every researcher in the world to use. They're also partnering with SparkCures, which helps myeloma patients enroll in clinical trials. With SparkCures, you can quickly find the trials you qualify for and apply right away. Look, HealthTree is not a guarantee for a cure or a replacement for your doctor, but it may help make the cure faster and your doctor better. And if a twin machine works once, we think the medical world will build them for other diseases. Someday you may find your twins all across the globe, like Parent Trap, but less sad because it's not about redheads. HealthTree.org already has massive momentum. All they need now is you. And remember, they'll never sell your data.
We are not out there selling the patient data. In fact, neither Jenny or I take a salary.
And neither do I, which is why my parents say, get a real job. Now, I asked earlier why Cheryl is still alive. And the answer, at least in part, is that she got the right information at the right time. HealthTree could provide the right information not just for doctors and patients battling life and death, but also to researchers battling for a cure. So please, click the link to sign up or donate. Let's change the way we treat deadly diseases. I'm David Vance, and you're watching SpellChek, a soft reminder that things can be better. Subscribe to our channel to see more videos like this one. This episode's sponsored by HealthTree, and a generous allowance by Carl and Emily Vance, unbeknownst to Carl.
But I worry about my family and what this all means for them too. Probably a little bit less today, because we've been gifted with 20 years that I didn't think we were going to have.